There's an old saying in Tennessee, I know it's in Texas, probably in Tennessee, that says, "Fool me once, shame on you." If fool me, we can't get fooled again.
In 2010, Forbes magazine accurately reported on the WHO's fraudulent response to the swine flu. The Parliamentary Assembly of the Council of Europe declared the false pandemic is one of the greatest medicine scandals of the century. By their own rules, a pandemic requires simultaneous epidemics worldwide with enormous numbers of deaths and illness. 11 weeks into the outbreak, only 144 people died worldwide, and the WHO declared a pandemic. Just 1 month before, they changed the rules. You could now have a pandemic with 0 deaths. And when questioned, they claimed the old rule never existed.
Now, there is some confusion here, and I hope to clarify. Having severe death has never been part of the WHO pandemic.
The WHO director, Dr. Margaret Chan, then went on to push left-wing politics, the redistribution of wealth for equity and social justice, and claimed that a welfare state is the savior of globalism. Over $18 billion was misallocated on this fake pandemic. In 2005, Dr. Peter Doshi published a paper entitled, "Are U.S. Flu Death Figures More PR Than Science?" drawing upon data from the CDC. The CDC bundles together influenza and pneumonia and counts them together, which is strange because according to their own data, there are far more deaths caused by pneumonia than the flu. For example, out of the 62,000 pneumonia and influenza deaths from 2001, only 18 cases were lab-confirmed influenza, 0.03%. From 1979 to 2002, there were an average of 58 influenza deaths per year. In 2004, CDC Director Glenn Nowak gave a presentation wherein he called upon the media to state concern and alarm, predict dire outcomes, and urge influenza vaccination. The Flu Protection Act of 2005 required the Secretary of Health and Human Services to conduct public influenza awareness campaigns preceding every flu season. Sales of the flu vaccine began skyrocketing, bringing in billions of dollars to the manufacturers, all for something that kills, on average, less than 100 people a year. In 2007, the New York Times published an article entitled, "Faith in Quick Test Leads to Epidemic That Wasn't." It explains how the same PCR tests being used now for COVID-19 misdiagnosed over 100 healthcare workers in New Hampshire and rang the bell for a whooping cough epidemic that turned out to just be the common cold. The PCR tests were never meant to detect a specific virus, and yet they are being used today to detect COVID-19. The CDC even admits that the PCR test will detect any viral infection as COVID-19, including the common cold. The current data from the CDC on COVID-19 shows the same fakery that we have seen so far. Just as the CDC falsely counted pneumonia deaths as influenza deaths in the past, they are now counting both pneumonia and influenza as COVID-19. You can see it clearly in the CDC's own data. Beginning in the end of March, right after the shutdown began in the U.S., pneumonia and influenza deaths dropped to 0, just as COVID deaths began to surge. COVID-19 is a quantifiable hoax. After years of unchecked big pharma fraud, we are witnessing their greatest swindle yet, and the amount of people wearing the mask only illustrates how effective their scam is. Will the mask wearers take the experimental vaccine for fear of what amounts to be the common cold? For Infowars.com, this is Greg Reese.